Hello, everyone. Thanks for joining us today. My name is Andrea Dalton, and I'm with Metro Council. I work at University Health, Behavioral Health. Metro Council, or the Metropolitan Council of Community Mental Health Centers, is a collaborative membership organization representing the public mental health system of community behavioral health centers serving the greater metropolitan Kansas City area. We provide support to our member organizations and education, information, and resources to the public on accessing quality health services. We host the Mental Health KC Conference every May, as well as provide free webinars on the second and fourth Thursday of every month. As a reminder, the views and opinions presented today are those of our speaker and do not necessarily represent the opinions of Metro Council. At the end of the webinar today, we will put the link and password to get the certificate of attendance for this webinar. I'll drop that in the chat probably about 5 minutes before the end, so be looking for that. You will need to stay till the end in order to get that certificate of attendance. And along the way today, our speaker has offered the opportunity for you to ask questions just as we're going. We'll kind of be keeping an eye on that. If it seems like she's getting too far into some other things and needs to rein it back in, we may pause that just a little bit. But you're welcome to type questions or comments in the chat. We also have the Q&A feature open and available, and I'll be keeping an eye on all of that and try to help facilitate that Q&A time today. All right, so let me give you just a brief introduction to our speaker. Angela is a social worker licensed in Missouri and Kansas. She holds master's degrees in art therapy and social work from California State University, Los Angeles, and the University of Kansas. She has provided behavioral health support and intervention to families, children, and adults for 25 years in Los Angeles, Johnson County, Kansas, and at Children's Mercy, Kansas City. She has held positions in various settings, primarily in community behavioral health, and currently at Children's Mercy. In addition to working with individuals, families, and groups, she has worked collaboratively with community behavioral health organizations, building relationships focused on supporting families experiencing behavioral and developmental health concerns. In her role as Behavioral Health Community Education Coordinator, she is focused on supporting the community and hospital through collaboration, connection, convening, and education about developmental and behavioral health. In a nutshell, she enjoys envisioning what could be and partnering with others to get to a better place. She is a question asker, connector, supporter, convener, partner, collaborator, sharer, spitballer, and helper. She has 3 kids, a young adult, and twin teenagers that she feels fortunate to be parent to and spend time with, and she really does like them. She also enjoys good pranks, good metaphors, and is grateful that you've chosen to share your time in this space. So with that, I will turn it over to Angela Guzman to present to us today on Have You Checked the Children?
Thank you so much, Andrea. I appreciate the introduction. I appreciate the opportunity. I appreciate being able to chat with everyone that is spending time here today. So with that, I'm gonna try to share my slides. Let's see if I can get this. Here we are. Okay. Andrea, can you see this? Can you tell me if this is showing up for you?
No, not
It
seen.
is not. Oh no. Okay, let me try it this way. How about now? No?
Nope.
Big nabbit. Let me try it one other way. So sorry. Oh wait. Oh, you know why? You have to hit the share button, I think. Here we go.
Now it's going.
Got it.
We got it.
Okay. So, have you checked the children? So essentially the presentation today is about how just one simple outreach phone call grew into this lovely youth-focused collaborative between mental health providers, mental health organizations, and then other developmental focused organizations in Wyandotte County. So my friends that presented with me at the Metro Council and who are part of the collaborative and part of developing this presentation are Christine Meyer, Diane Victory. Christine Myers from Sunflower. Diane Victory is from PACES. Sean Swindler is from KU's K-CART. Phyllis Wallace is from Wyandotte CDDO. Bethany is also from PACES, and then myself from Children's Mercy. So our objectives today, really, I think the lowest hanging fruit is to share with you what each of our organization's missions are, what those services and what accessing those services look like, but what each one of our roles, how it contributed to that, to the ongoing, actually, multi-organizational collaboration. And then just talking about the value of collaboration, how the value overlaps not only for the family that we're serving, but also for the organizations that we represent in the community as a whole. So the high level overview of the presentation today and the why behind it. I'll be presenting on a vignette, an illustrative vignette, just to walk through an example of a family that has obtained services through one of our organizations and the importance of connecting to those other organizations and providing that care, that holistic care for the patient and family. And then really, I think as providers and as mental health professionals and as collaborators, I think one of the things that isn't often shared is how much hope is provided through collaboration. And one of the places that I myself find hope is that I think as one person providing services to a family, it can feel really overwhelming when you realize that there are multiple psychosocial concerns, there are multiple needs, and without the support of others, it's going to be so challenging to get that family what they need. And then also, I think recognizing that we're all complex, and there's a reason why we do those assessments that look at multiple domains and multiple areas for stressors to occur, and that in realizing that each stressor can exacerbate other stressors. Excuse me. So I think of this kid that I worked with some time ago as an example. And this kiddo came in and had a lot of anxiety. And in digging a bit deeper, learning that the anxiety wasn't just this siloed anxiety that was coming out of nowhere. This kiddo had anxiety around school. And part of the anxiety around school was from a lack of homework completion. She was really challenged with getting her homework completed because her family didn't speak English as a first language. And so homework help at home was really difficult for her to get. And she also came from a single parent family. So that after school time with a parent providing homework support was pretty limited for her. So in looking at that, if I was solely focused on helping this kiddo with anxiety and not aware of those other pieces, I don't know how much progress would have been made in supporting her, assisting her with the anxiety. So the other pieces, so for professionals, as I mentioned earlier, those partnerships help avoid burnout. If many hands carry a load, it is such a lighter load. And then I also think that so many of us have resources that others of us aren't aware of, places where we found success, places where we've been able to share families, to share those resources with families. And then I also think about if we are providing that support from our area, from our lens, those for families that have complexities and perhaps get into a system that isn't able to provide care for all of their complexities, that system can become bottlenecked, which then limits those services for other families. And so I think about kids that come through maybe behavioral health or mental health focused clinics, and they have some developmental concerns also. Maybe they have a diagnosis of autism, and without the additional autism support, that mental health service can become backlogged. So I think it also helps with keeping availability open for our specialties. And then it also helps us maintain momentum, and it kind of keeps us on track too. If we have other professionals that are involved with us in caring for patients, and that check-in is happening, we're more likely to stay on the road with our work with that family. And then, as we know, working with families, working with parents specifically of kiddos that can have some challenging behaviors and related to those behavioral health diagnoses, when their kiddo is doing better, parents don't experience that burnout or that frustration or those challenging moments nearly as often. And that additional energy promotes additional good care. So for community, I think really looking at collaboration and providing care for those folks and those families that are most challenged and maybe most vulnerable is really a measure of who we are as a community, and then as of our community health also. So let's get into it. So, as mentioned previously, I am from Children's Mercy. I previously worked in the social work department, and then I worked in the developmental and behavioral health department, and have recently moved to the Office of Community Impact. But our vignette starts like this. So the patient that I mentioned earlier, that this presentation will be centered around, is a 13-year-old boy who's presented to our emergency department, and he has a comorbid diagnosis of autism and ADHD. He's medically complex. He resides in Kansas City, Kansas. He receives services in our ambulatory clinic, and he has a history of receiving inpatient services. So for context, and to provide you some information about the services that are provided in the developmental and behavioral health division, and then other behavioral health services provided across Children's Mercy, I have a cheat sheet because we have quite a bit. So in D&B, which is what the developmental and behavioral health division is affectionately known as, our D&B is comprised of our psychologist, our psychiatrist, our developmental pediatricians, our PMHNPs, APRNs, we have BCBAs, nurses, social workers, support staff, and this is our ambulatory clinic, so our outpatient clinic. We have multiple specialty clinics under D&B, and that one would include ADHD, our autism clinic, our eating disorders clinic, our day clinic, which is, I believe, our newest clinic, which is our depression and anxiety and youth clinic, which is very exciting because we know that in the Kansas City area, depression, and actually nationally, I believe, depression and anxiety in adolescents is really high. So this clinic is pretty spectacular because the intention is to open access to care for those kids that are struggling with depression and anxiety in the community. So expand depression and anxiety services, and then also improve that access. So we also have our tick and Tourette clinic. And in D&B, it is a really, really high volume clinic. I think from January of 23 to January of 24, there were 48,000 patient appointments. And what do those appointments look like? So D&B does a whole lot of evaluation. And evaluations are important because we know that that is oftentimes the gateway to services. So for instance, with IDD services, until you have that diagnosis, you won't be eligible to receive services through KCRO on the Missouri side or one of the CDDOs on the Kansas side. We also provide therapy services. And again, this is a high level view, but those therapy services are typically provided by psychologists that are embedded in our medical specialty clinics. For instance, we have psychologists that are embedded in HEMOC. And the reason why therapy services are provided there is because our psychologists are trained in those behavioral health concerns that are intertwined with or overlap with specific medical concerns. So they really know the ins and outs of what behavioral health looks like for a kiddo that's in cancer treatment or has a cancer diagnosis. And the reason I mention this, why this is important, is because when I was in the community serving families before I got into Children's Mercy, going on 6 years ago now, one of the things that I found so frustrating was why some of my families on my caseload were able to receive services at Children's Mercy and others weren't. And it was really unclear to me. So from this side, realizing that these psychologists are providing this care to kids that are medically complex, because if they weren't cared for at Children's Mercy these specialties, they would have very limited options in the community to receive that care. So this is the reason why that these kids are focused on for care. And now it makes sense. The other places that we provide behavioral health services are in our inpatient unit. So if we have a kid that presents to the emergency department and then is admitted to Children's Mercy, we have a behavioral health inpatient team because we don't have an inpatient psychiatry unit. But this behavioral health inpatient team is a multidisciplinary team that's comprised of psychiatry, psychology, social work, child life, and their medical team. And this behavioral health inpatient team rounds daily to support the needs of our patients that are at Children's Mercy with behavioral health concerns. One of the places that I think folks most think about kids receiving behavioral health support and care is in our emergency department, because oftentimes parents and families are told if your kiddo is experiencing a behavioral health crisis, where do you take them? You take them to the emergency department. I know we have some additional resources now that for time's sake, I'm not going to dig into, but the ED is now, I think, one of several resources that families can access if their child is experiencing a behavioral health crisis. I will say, however, if there's any medical concern, if the need is emergent, of course, the emergency department, your closest emergency department, is where we suggest that families get their kiddos to be evaluated at. But our AIMS team is our acute mental health screening team, and it is our master's level clinician social workers, but I think we also have some LPCs now providing suicide assessment, and then helping to support with connecting to the appropriate level of care, depending on the determination of that assessment. And I want to mention that suicide screening is also completed in ambulatory clinics in DNP, of course, but then also in ambulatory clinics outside of DNP. And so for kids 12 and over, they are asked 5 pretty simple questions through the ASQ to determine if they have any suicidal ideation and further assessment is warranted. And I will tell you that, okay, I'm just going to confess. When I first got to Children's Mercy, I was like, so many assessments. That feels like a lot of assessments. And as a social worker covering a clinic, and I received the page that there was a patient that had screened, they call it screening positive. I walked down to provide that suicide assessment, and this kiddo is one of the cutest kids you've ever seen in your life. And you would never know by laying eyes on this kiddo that they were experiencing any type of behavioral health concern, truly. So in chatting with this kiddo, I asked how long they'd been feeling, or they'd been experiencing suicidal ideation, and the kiddo said 2 years. And so then I asked, oh my gosh, so 2 years, have you shared this with anyone else? And they said, no, no one had ever asked. So from that, I became a firm believer in assessment, that we need to be asking kids if they're feeling suicidal. So the other places, let's see, additional behavioral health services, our social work family therapy team provides therapy through several modalities, TFCBT, PCIT, CPP, and then general family therapy. We also have behavioral health clinicians that are located in our PCC clinic at Broadway, our primary care clinic at Broadway. And those are 2 psychologists are co-located. And then one of our social workers is also a behavioral health clinician. And why this is important, because we know that, and I just heard this recently, 30 to 40% of PCP or pediatrician appointments involve a behavioral health concern. And so being able to connect families to a behavioral health clinician in that moment is critical. Because the other thing that we know is that 50% or more of families that we refer to additional services, so services in the community, don't make it to those referral sources. So with the behavioral health clinicians being embedded in the primary care clinic to be able to provide that therapeutic support in that moment. And then also there's some brief therapy appointments following, and including that connection to additional behavioral health services is really filling a huge gap. The other thing I'd like to mention is that we have some behavioral health clinicians that are also in our community practices now, our affiliated community practices, and that's pretty exciting. And I would also say that this isn't necessarily a new service. There are community practices that have had behavioral health folks embedded in them for some time. So onward, one of our other clinics that provides, I think if this is touching behavioral health, but is really impactful to behavioral health, is our Goldilocks clinic. And again, as someone that provided services in the community to kiddos that were just having a hard time getting stabilized on their medication, that creates a problem for so many pieces of that kiddo's life. So at home, it can be problematic because, and for parents are having a hard time parenting to kids that aren't stable on their meds. At school, they're having a hard time feeling successful at school. And so for their teachers and for themselves and for their peers in so many places. So the Goldilocks clinic is our pharmacogenetic clinic, which is for kids that have had a hard time getting stabilized on medication. And this is the cheek swab clinic. So they take a look at what medications would be most effective, what medications aren't helpful. They write up a beautiful biopsychosocial, and they review their findings with the family. And I find this to be such a huge support. We have additional parent-focused services. So we have a couple of parent-focused training and education groups. We have what we call our ADHD BPT, and we have our Ruby Clinic. So the Ruby Clinic is an autism focused, a parent-focused group clinic for parents that have kiddos that are diagnosed with autism. And then our ADHD BPT is for parents that have kids that have a diagnosis of ADHD. We have two groups. We have one that's for elementary school age kids, and then we have one for preschool years. And so for the preschool years, highly suspected ADHD and ADHD diagnoses. And then also for the elementary school kids, it's for those kids that have been diagnosed. So it's a limited number of sessions. They're virtual and they're billed through insurance. And then we also have additional resources at no cost for families that can be found on Children's Mercy's website. So we have Prepped and Ready, which I think is one of our most often talked about resources. Again, completely free. It's a parent focused, and I'm boiling this down for sake of time, but it's a parent focused suicide prevention video series. It's 45 minutes in length. It's research based. So there's a survey at the beginning of this video series and a survey at the end. It's on demand. You can get it online. But the really beautiful thing about this video series is from what parents learn in the videos, there's also the opportunity to have a parent toolkit, a suicide prevention toolkit sent to them at absolutely no cost following completion of that video series. It's developed by Shayla Sullivan, one of our psychiatrists, and it is a phenomenal resource. I will also caveat with saying while those supplies last. We also have recorded parent trainings focused on parents that have kids that have autism, and it covers these trainings cover a variety of topics. And again, they can be accessed on the Children's Mercy website, absolutely free. We have an autism newsletter that is sent out, I believe, monthly, and it's chock full of resources and information. We also have a parent mentor program. It's called our POPS program. And this is a parent that has experienced a certain diagnosis or a certain medical situation with their kiddo that mentors a parent that is going through that similar situation or similar diagnosis. Again, absolutely free. I'm going to say free all day long. We have a parent powering family series, which is this is pretty cool because families and professionals, the community can register to attend a presentation. They're offered monthly, usually over the lunch hour. And if you register to attend, you're able to ask the presenter, who is one of our providers or content experts from Children's Mercy. And we cover a variety of topics. I think we have 3 or 4 that are behavioral health focused. And you're able to ask questions during the presentation. If you missed the presentation, we have them recorded and you can access them online. And again, that was our Powering Family series. We also have behavioral health tips for families on demand videos, little 2-minute videos that talk about why those daily living things that we do are important to our mental health. So why is sleep important and how to get sleep, how to get good sleep? Why is exercise and nutrition important? How to get those things. And those little 2-minute videos, it's also a series, are provided by the providers out of DNB. We have care workshops, which are also provided through our social work family therapy team. And this is a lovely resource also. It's a low commitment parent group, and it's offered monthly. Again, it's absolutely free. It's 2 90-minute virtual sessions for parents only, and parents can register online or by calling. That information is on Children's Mercy's website, but it's focused on improving that parent-child relationships, providing strategies for parents to promote positive parenting. It just broadens a parent's toolkit with that goal of improving the relationship with the kiddo. We also have information about opioids, fentanyl, and how families can obtain naloxone or Narcan. And then ultimately, we also provide referral to the community, typically from our social workers or sometimes through our providers. So having that connection to the community is important, because if we look at that behavioral health care continuum, we're only one part of it. So because it's
Angela?
yeah,
Oh, I was going to say, Angela, there's a few questions. Do you want to pause for a moment and take a couple of these?
my train was just rolling down the track.
Yep.
I can absolutely pause. Thank you.
So one person in the chat said the last time I tried to get an appointment for autism services at CMH, they said they were only doing evaluations and not providing services for patients with a diagnosis. What do you suggest?
So what we have at Children's Mercy following that autism diagnosis, we have an autism resource navigator. We have a few people that help connect families to the resources that are available in the community, because we don't want families to feel like they have a diagnosis and then they're left unsupported. We've also expanded our autism services, and we have it's called the AND Clinic. Oh, I'm not going to remember because it's new what that acronym stands for off the top of my head. But anyway, got it. Continuity of Care Clinic. This is for kiddos that receive a diagnosis between birth and I think it's 39 months. So when a family receives that diagnosis, they're then provided support and connecting to those other resources and services, as well as that pediatric care up to 39 months. That is something that's hopeful to be expanded, but that's where it started.
There's kind of a related question. If a person has a diagnosis of autism already and can be verified, can they be fast-tracked into the Ruby program?
So for the Ruby Clinic services, that is, again, it's parent facing. And as far as I know, I don't know that they have a wait list or much of a wait list if they do. When I hear about wait lists at Children's Mercy, and these are always in flux too, so mind you, the groups aren't necessarily one of the things that I hear wait lists about. So and again, we're really working on expanding services, and wait lists are something that's a hot topic at Children's Mercy. We really do try to mitigate those wait lists as best we can. And when I think about the resources that we provide that I just mentioned, I think a lot of that is around being able to provide support to families, understanding that they may be waiting to get into services. So there's some education, there's some tools out there. But for the Ruby Clinic, like I said, I don't know that there's much of a wait. For additional information, my email will be included on these slides, and feel free to reach out to me and I can get you connected to the folks that know even more about the Ruby Clinic services.
Another person asked if the program applies to grandparents also. You mentioned parent-facing programs, but do grandparents also benefit from that?
So I think for the most part, and again, this is like high level overview, I would say those primary caregivers, and there would be times where additional folks that provide support to that kiddo would be included or could be included in care. If a grandparent is that primary caregiver, then absolutely. If the grandparent is providing support to the parent, probably not as much. But again, I think that would be a great question for the provider that is engaging with the family, providing that support to the family.
One person asked, how long will your therapist typically continue to see a kiddo after the initial encounter?
So I think that varies. These are really good questions, by the way. My goodness. So I think that depends on the service. And so as I mentioned, family therapy provides services with several different modalities. Psychology also provides those services that are embedded in clinics. So I think it's what's clinically appropriate. We wouldn't want to discharge or end services with a kiddo that was still in need of additional behavioral health support and services. So I can tell you that we really do work to connect to those additional behavioral health organizations, supports and services in the community to ensure that that ongoing care, if it's needed and it needs to be beyond Children's Mercy's walls, is connected to.
I think just one more quick question, hopefully for now. For people who live in the St. Louis, Missouri area, can they access resources, webinars, virtual services, parental support as well?
This is such a good question too. My goodness. Okay. So for our resources, yes, absolutely. Those things that I just mentioned that are on our website, the on-demand videos, things like that. Yes, that is open to the public. Everybody can access them. I would say with some of our services at CMH, there may be a bit of a parameter for how far out services are provided. And I think the DNB intake department is so well versed in knowing which services to what parameter. And so again, connect with me and I can funnel those questions to the appropriate folks to get you the answers that you're looking for. Did I answer that, by the way?
I think that was great.
Okay, perfect. Can I move on?
Yep, I think go on ahead.
Awesome. Thank you. Oh my gosh, keep the good questions coming. I love
Yeah,
that.
they're great.
And I have to tell you, it is a little odd presenting. I feel like I'm presenting to myself because I can't see any faces. So, and I'm sure you've heard that before. So thank you for bearing with that. Okay, so the call from Children's Mercy for this 13-year-old boy was to PACES. And PACES is the Wyandotte County CCBHC, formerly known as Community Mental Health Centers. And the reason why I referred him to, or I reached out to PACES, is because it looked like he would meet criteria for their services and for the SED waiver. And also he lives within that catchment area. So what we know about PACES is they serve children and families in Wyandotte County, and they also have a menu of services. They provide services in schools, they have crisis services and supports, and they have all of the SED waiver services. They serve youth from 3 to 22. They have, and I believe it's an open access intake where folks can walk in and receive get an intake to be able to access services. And then they're also fantastic with that care coordination and accessing additional community supports to get a family what they need to support, improve their mental health, address their mental health. One of the things that I would mention too is that back in the day, we used to call it episodic treatment from community mental health. So their goal is to really help stabilize a patient, or I'm sorry, they call them clients, to stabilize a client and to improve that functioning and meet those needs. And then to connect to those community resources also, and then work to discharge, knowing that episodic treatment is definitely a thing, and folks may return to services if they hit a bump in the road with their mental health. So from PACES, who else was outreach to? Oh, because PACES is mental health focused, PACES said, let's reach out to the Wyandotte CDDO. So what we know about the Wyandotte County CDDO is that they are essentially the gateway to IDD services, and they keep the IDD waiver service wait list. They are the keepers of that for Wyandotte County, or the managers of that. What we also know about those IDD waiver services in Kansas is that there is quite a lengthy wait list. which is also another reason why these collaborations are really important. If families are waiting to get into those IDD services, being able to meet needs in other ways and other places can be really helpful. Another thing to note is that CDDOs don't provide that hands-on service. They do connect families to case management once they begin accessing care, once they're qualified for those waiver services. And those case managers can be a contact and a support and a navigator while they're waiting to get off the wait list and to get into IDD services. So this is also very confusing for a lot of folks because we have the SED waiver and behavioral health, mental health services over here. We have the IDD waiver and developmental services over here. And then how do those come together and how do they supplement, complement, work together? So, because we were trying to sort that out, Phyllis Wallace from the Wyandotte CDDO, she's a lovely human being, reached out to Sunflower Health Plan, and she has a connection to Christine Meyer there. So our little group grew from Children's Mercy PACES to the CDDO and then on to one of the MCOs, Sunflower. So Christine is truly a wealth of knowledge as a services coordinator, transition of care coordinator. She also has a background as a BCBA. So not only does she have this higher level view, but she also has that direct care approach view. And she has just been an amazing resource to have in our group. So her role and actually Sunflower's role, because they are the MCO, they manage that waiver. They're the insurance that is that waiver for that family. And so she really knows what those services through that waiver look like. She's also a great advocate. She understands that there's a wait list and families are going to have needs while they're on that wait list. We've talked a lot about accessing services through crisis funding and what that looks like also, because that is another option for accessing services. And then in her role, because she has that higher level view, that collaboration not only across systems, but across the state is something that she's been well versed in. She can also tell us kind of what's coming next, because we hear that there's going to be some expansion of that IDD wait list. I don't think it's going to happen for a couple of years, but it's coming. And then last to join our collaboration, but definitely not least, if you don't know Sean Swindler, you are missing out. Sean Swindler is an amazing asset to the community. He is an amazing resource. He knows so much about serving families that have youth with autism. And then also how systems connect and overlap. So he joined our collaborative too. And some of the things that his group does is provide parent training and expand the pool of folks that are trained in our community to best be able to provide support to folks that have autism, to youth that have autism, and to parents, the parents of these kiddos. So one of the gaps that his group saw and continues to see and continues to address is lack of training for folks that are providing that hands-on support. And then also those wait lists and then gaps in services and care in less populated communities, those rural communities. And then additionally, like I mentioned earlier, just navigating these complex systems, mental health, IDD, you've got a medical system, it just can be pretty daunting for families. So what do we need to do? we need to figure out ways that we can communicate better and really know our roles and have an understanding of other systems so we can support patients or clients or families with getting to where they need to be. We also need to help make access to services a bit easier. So limiting that complexity, if we can support a family by making a phone call, connecting with someone that can help with completing that paperwork and knowing when it is time to provide that handoff. And then also taking a look, because we work within the systems, we have a pretty good view of where those gaps are, where they occur, and if we could fill them, how we'd best be able to serve, how those families would best be served. So these are our additional collaborators so far within our collaborative meeting, which happens monthly. But we have Children's Mercy, some of our autism clinic staff, D&B and Office of Community Impact, K-CART, that's Sean's group, the TIES program, which is our community focused social work group, some of the school districts in KCK, Families Together, and then United Health attended early on. So, do we have any questions?
I see one person has their hand up, and I'll just invite that person to put the question in the chat if you could. It's really the best way we have for this format. And here it is. Thank you. The question is, can you briefly elaborate on the strategies that you use to reach underserved or marginalized communities with services? Great question.
That is a really great question. So as I mentioned earlier, the behavioral health clinician position, I think this is a great example of that because at Children's Mercy, we provide support to a lot of communities across the board. And we have a high number of families that seek services through us that receive Medicaid. So there's that. And we also, as I mentioned previously, partnering with the Wyandotte County Collaborative here. Wyandotte County has some, I'm gonna make an assumption here, but a pretty high level of Medicaid recipients in Wyandotte County. And so connecting with these other organizations that are providing care and service there is another way to extend the reach to support those communities. And I'll also, one other piece, sorry, really quickly, our Office of Community Impact has really taken a look at where services are provided in our community, or we continue to take a look at this, and we work to do better in this, and looking at those social determinants of health, where we can provide services and supports and care and resources to families that are experiencing some challenges. That's something that we're constantly looking at.
Thank you. That was great. Great question. Great answer.
That was a great question.
Here's another question. Are there any supports or considerations for ADHD/autistic parents of ADHD, ASD children who are just now discovering their condition due to their children being diagnosed?
Okay, can you repeat that question for me?
Yeah.
I think
I think that if I can maybe summarize it, what kinds of supports are available or considerations are being held for parents of children with ADHD or autism diagnosis who are like just now finding out that their child has this?
so kind of as they start on their journey, like what services.
Oh, and I think actually, if I can read into it just a little bit more, I think who are discovering as a parent that they have ADHD or autism, and they're just discovering that because their children have been diagnosed. And yeah, great question.
That is a good question. Okay, so let me make sure I understand it. If I understand this correctly, so a parent is now realizing that they have their own like behavioral health concerns because their kiddo's getting it. So now they're more getting these diagnoses. So now they're more aware of what these behavioral health concerns look like. So now they're realizing that they have they have these concerns too. Is that
Yeah.
what okay.
Yep. Yep.
So that's a really good question. I think of some services around town. And again, man, that's a good complex question. So I think of those resources in town, places like NAMI, that provide education, information, support, not only for families, but also for the caregiver too. So I think that might be a great place to start. I know at the CCBHCs on the Kansas side and also on the Missouri side, there are parent support opportunities. And really, I think one of the things that we're aware of too is that oftentimes when kids are experiencing some mental health concerns, parents can also be experiencing mental health concerns. So we not only work with kids, CCBHC, CMHCs, and also at Children's Mercy too, when we're working with a kiddo, we're really working with the whole family. We're working with those parents too. I think another option for a parent in that situation is to seek their own care and their own treatment. Prioritizing their care is really important. Because not only does it help with their own mental health, but also models that to their kiddo how important that treatment and care is.
And Rochelle pointed out in the chat, the Whole Person is another organization that has some good resources.
See, that's exactly
Perhaps.
what I'm talking about.
Yep.
Like across the community, everybody has like different things to contribute or remembers different things. That's one of the things I love about collaboration. Not one person has to remember or know everything. We're pulling on like multiple folks, multiple systems, multiple organizations to really broaden that knowledge and broaden those services and supports.
Oh. Are there other questions? I will go ahead and put the link and the password for the, sorry, I'm losing my words. The link and the password for the certificate of attendance, that's what it's called, in the chat so that you can access that. I see we have one person who needs to duck out a little early. Any other questions or comments for Angela? Come on screen too. Okay.
If not,
Well,
well,
Angela, any last words you'd like to share with us?
my last words are thank you. I appreciate the time being here today. I appreciate being able to share some information and hopefully expand your knowledge base just a little bit. And if you have any additional like questions, feel free to reach out to me. I do love collaboration. That is my love language. So feel free to contact me. And I appreciate you. I appreciate you, Andrea. I appreciate you all attending.
Thank you. Thank you so much, Angela. That was really, really informative. And a lot of people are expressing their gratitude in the chat for all the resources, all the information that you've shared today. So it's really, I learned a lot just sitting here listening
I'm
to you.
so
So
happy
thank
to hear
you.
that. Thank you.
All right. And thanks everyone for joining us today. We have recorded this webinar. It will be available on the Mental Health KC website or on our YouTube channel, which you can subscribe to and you can get the notifications for on YouTube when those videos are available. We do have a little lag time on that. Keep in mind, we are all volunteers. And so sometimes it does take us a little bit of time to get that up and going. But when it's available, you can access Angela's talk again, and any of the previous webinars that have been recorded as well. Like I said, the certificate of attendance link and password is in the chat, and I'll drop it in there one more time just to make it easy to find it. You will have to click that link, type in the password, and then download the certificate from a little link that's on that page once you open that up. Our next webinar is the 4th Thursday of this month from 12 to 1. I'm not certain what the topic is of that one. I haven't seen that one published yet, so that information should be coming out soon. If you'd like to get updates on those, if you aren't subscribed to our newsletter, you can do that through the mentalhealthkc.com website as well. Actually, mentalhealthkc.org, not .com. My apologies. mentalhealthkc.org is where you can access all of that information and much more. All right, thank you all very much. Big thank you again to Angela for sharing her information with us today. Really fantastic, and I appreciate all of you joining us today. Thank you.